You know that feeling? Like you're
Mhm.
constantly juggling, making split-second decisions, maybe just trying to keep your head above water.
Oh, absolutely. That feeling of being overwhelmed.
Yeah, exactly. Whether it's work or something personal or just, one of those weeks.
We've all been there.
Well, today we're kind of looking at how people in maybe one of the most intense jobs out there, emergency medicine, handle that kind of pressure day in, day out.
Right. We're pulling from some really interesting sources, one specifically on navigating stress in emergency medicine, and also Stephen Covey's classic, The 7 Habits of Highly Effective People.
And our mission really is to see what key strategies we can pull out, things that honestly anyone could use to be more effective, more resilient when things get tough, without getting bogged down in theory overload.
And when you look at emergency medicine, the pressure is just,
Wow.
wow. The sources really highlight it. It's not just demanding, it's often like a sustained crisis environment.
I saw some numbers on that.
Yeah.
The burnout rates are quite high, aren't they?
They really are. Startlingly high. A 2024 survey found, 63% reporting burnout.
63%.
Wow. And another big analysis showed around 40% dealing with serious emotional exhaustion, feeling detached. It says a lot.
So understanding how they cope, even just some of their strategies, could actually give us some valuable clues for managing pressure in our own lives.
Exactly. Because the core challenges, stress, prioritizing, self-care, those are pretty universal, even if the stakes feel different.
Okay, so that brings us to Stephen Covey. You mentioned the 7 habits. He talks about this inside-out idea. What's that about, basically?
Right, the inside-out paradigm. It's a
Yeah.
fundamental shift. Instead of just trying to change, the world around us to make things better, the outside-in approach.
Which is tempting sometimes.
Oh, definitely. But Covey argues real effectiveness starts inside. It's about your character, your core values, your beliefs. That's the foundation.
So things like integrity, fairness, that kind of stuff.
Exactly, what Covey calls character ethics. Plus, being proactive, realizing you choose how you respond to things, and taking personal responsibility. It's about building that strong internal core first.
Which I guess in emergency medicine must be crucial. So much is unpredictable, right?
Totally. They can't control who comes through the door or what emergency happens next. But what they can control is their own attitude, their skills, their professionalism, their ethics. That inside stuff becomes their anchor, their source of resilience.
Okay, let's maybe dig a bit deeper into those specific pressures they face. The sources really laid them out.
Yeah, it's quite a list. You've got the obvious things like shift work, which completely messes with your body clock, your personal life.
Makes sense. And the unpredictable nature of it all.
Right. Patient flow can go from 0 to 60 in minutes. You're constantly on high alert. Then there are the risks, exposure to diseases, sometimes even violence.
And the emotional side must be incredibly draining. Dealing with trauma, young patients, delivering bad news.
Definitely. The emotional toll is huge. Situations that might resonate personally, the sheer weight of responsibility, the fear of making a mistake, litigation worries.
And workplace stuff, too. Conflicts.
Yep. Workplace conflict adds another layer. And of course, the pandemic just piled on more stress, fear of getting sick, worrying about family, constantly changing rules.
Plus, I imagine just the paperwork, the admin burden.
Oh, yeah. Increasing administrative tasks that pull them away from actual patient care. It's a pressure cooker environment, really.
And the consequences if that stress isn't managed. We mentioned burnout.
Right. Burnout is the big one, the exhaustion, cynicism, feeling detached. But it goes beyond that. Lower job satisfaction, getting sick more often, just a general decline in well-being.
And that impacts care, presumably.
Hugely. It can erode empathy, which is so vital. It can strain the doctor-patient relationship. And worryingly, it can even increase the risk of medical errors.
Okay, so it's a tough environment. How do people navigate this? That brings us back to Covey's habits, starting with what he calls the private victory.
Exactly. The first 3 habits. They're about mastering yourself first, building independence. Habit 1 is be proactive.
Be proactive. So this isn't just about, being busy, right?
No, not at all. It's more fundamental. It's about recognizing you have a choice in how you respond to events. Covey uses this idea of the circle of influence versus the circle of concern.
Okay, explain that a bit.
Your circle of concern is all the things you care about, world events, maybe hospital policies you don't like, traffic. Your circle of influence is the stuff you can actually do something about.
Ah, okay. So proactive people focus their energy there. on their influence.
Precisely. They take initiative within that circle. They don't just react to things, they act. Responsibility, Covey says, is really responsibility, your ability to choose your response.
How does that look in the ER?
Well, think about anticipating a surge in flu patients and setting up extra assessment areas before it hits. Or during COVID, proactively creating separate zones. It's about identifying problems within their influence and acting, not just waiting for things to happen to them.
Engaging with the team, improving communication, continuing to learn. That's all proactive too.
Absolutely. For you, the listener, think about where you feel overwhelmed or reactive. What's actually in your circle of influence there? Shifting your focus can make a huge difference.
Okay, that leads into habit 2. Begin with the end in mind.
Right. This one's about vision. Knowing where you're going. What's your ultimate goal? What are your core values?
Like having a personal mission statement.
Exactly. Or a clear picture of the desired outcome. The idea is that everything gets created twice, first mentally, then physically. You need the blueprint before you build the house.
So in emergency medicine, the end in mind is always.
Primarily, it's about providing the best possible patient care, right? That's the guiding principle. Leaders might set a clear vision for the department based on that. Individual doctors might develop their own mission focused on ethical, patient-centered practice.
And reflecting on tough cases helps keep that focus.
Definitely. It reinforces why they're there. For you, the listener, what's your end in mind in different posts of your life? Work, family. Having that clarity helps guide your daily choices.
Which brings us neatly to habit 3. Put first things first. This sounds like time management.
It is, but it's time management based on habits 1 and 2. It's about organizing and executing around your priorities based on importance, not just urgency.
The important versus urgent matrix. I remember that.
Exactly. Covey's time management matrix. Quadrant first is urgent and important. Crises. Quadrant 2 is important but not urgent. Prevention, planning, relationship building. Quadrant third is urgent but not important. Interruptions, some meetings. And quadrant the fourth is not urgent, not important, time wasters.
And highly effective people focus on quadrant 2.
That's the goal. Spending time on the important, non-urgent stuff prevents many crises from happening in the first place.
In the ER, this must be constant. Triage, right?
Absolutely critical. Triage, assessing patients using systems like ABC or DRSABCD is pure. Put first things first. Prioritizing the most critical patients when resources are limited, it's life or death prioritization.
Wow.
Even managing time during an encounter, delegating tasks, effectively, it's all about focusing on the most important actions right now. For you, the listener, think about those important quadrant 2 tasks. Are you making time for them or letting the urgent stuff crowd them out?
Okay, those first 3 habits build independence. Now we move to interdependence, working with others. Habit 4. Think win-win.
Right. This is about seeking mutual benefit in all interactions, moving away from a scarcity mindset, if you win, I lose, towards an abundance mentality. There's enough for everyone.
So it's not just compromise.
No, it's aiming higher, finding a third alternative that's better for everyone involved. It requires balancing courage, standing up for what you need with consideration, understanding what the other person needs.
And in the emergency department, teamwork is everything, I imagine.
Totally inherent. Collaborating with nurses, techs, specialists, consultants. You have to find ways that work for the whole team to get the best patient outcome. Balancing, say, a resident's learning needs with the immediate needs of a critical patient requires that win-win thinking.
Understanding the patient's perspective, too, even when it's difficult.
Absolutely. Fostering a positive environment where people feel respected. For you, the listener, in your collaborations, are you genuinely looking for that win-win solution?
Habit 5 feels closely related. Seek first to understand, then to be understood. Listening first.
The listening habit. And it's about empathetic listening, really trying to see the world from the other person's point of view, understanding their feelings and their meaning before you jump in with your own agenda or advice.
That sounds challenging, especially under pressure.
It is, but it's crucial. In the ER, truly listening to a patient, even briefly, can uncover vital diagnostic clues, asking clarifying questions, reflecting back what you hear.
And with colleagues.
Even more so, especially in disagreements. Truly understanding their reasoning before you argue your case. Using clear communication tools like SBR situation, background assessment recommendation helps ensure understanding.
Avoiding jargon with patients and families too, I guess.
Big time. It impacts diagnosis, safety, trust, team dynamics, everything. For you, the listener, how are your listening skills? Do you really try to understand before you make your own point?
Okay, then habit 6, synergize. What does that mean exactly?
Synergy is essentially the idea that the whole is greater than the sum of its parts. It's about valuing differences in perspective, experience, style, and using those differences to create something new and better than any one person could alone.
So 1 + 1 = 3 or 10 or 100?
Kind of, yeah. It's creative cooperation. In emergency medicine, this is the goal of the multidisciplinary team. Nurses, doctors, paramedics, specialists working together, valuing each other's expertise.
Especially during critical events like a resuscitation.
Exactly. Clear roles, open communication, leveraging everyone's strengths. That's synergy in action. It leads to better outcomes than if everyone just worked in silos. For you, the listener, how can you better tap into the diverse perspectives around you to achieve more?
All right. We've covered the private and public victories. The last habit stands alone. Habit 7, sharpen the saw.
This is the habit of self-renewal, taking time to maintain and enhance yourself across 4 key dimensions: physical, mental, emotional, social, and spiritual.
Okay, break those down. Physical is next.
Exercise, nutrition, stress management, and crucially for shift workers, getting adequate rest, respecting those circadian rhythms as much as possible.
Oh, cool.
Continuous learning, reading, professional development, keeping your mind sharp and engaged. Staying up to date with medical advancements is vital in their field.
Emotional, social.
Building and maintaining strong relationships, family, friends, colleagues. Having a support network. Peer mentoring can be really important here. Hobbies, positive work environment connections. This isn't necessarily religious, though it can be. It's about connecting with your core values, finding purpose and meaning. Could be through meditation, nature, art, service, spiritual practice. Whatever gives you that sense of perspective and peace.
Given those burnout stats we talked about, this habit seems non-negotiable for emergency physicians.
Absolutely critical. Recognizing the signs of burnout, exhaustion, cynicism, detachment, and proactively taking steps. Taking breaks during shifts, using vacation time, seeking professional help when needed. It's not selfish. It's essential for sustainability.
Taking regular time off is key.
Yes. You can't keep cutting with a dull saw. You need to take time to sharpen it. For you, the listener, which of these 4 areas needs a bit more attention right now? Where do you need to sharpen the saw to prevent your own burnout?
It's also interesting how the sources mention the way these doctors contribute beyond just the immediate patient care in the ER.
Yeah, that's a really important point about interdependence. Many take on leadership roles in hospitals or healthcare systems.
Right, management, patient safety initiatives, that kind of thing.
Exactly. They're involved in research, advancing medical knowledge. They advocate for patients and the specialty itself, fighting for fair policies, addressing drug shortages.
Mentoring younger doctors, too.
Huge. Guiding students and residents, and just the day-to-day collaboration with everyone in the healthcare team. It all ties back to that idea of interdependence and seeking win-win outcomes that benefit the whole system, not just one part of it.
So wrapping this up, it feels like looking at the intense world of emergency medicine really does offer some powerful lessons for anyone dealing with pressure.
Definitely. The challenges are unique, but the principles for navigating them, Covey's Inside Out, focus on character and proactivity. And these 7 habits, they provide a really solid framework.
A framework for effectiveness, for resilience, for well-being that goes way beyond medicine.
Exactly. And hopefully for you, the listener, this deep dive gives you a kind of shortcut to some really useful ideas for managing pressure and focusing on what really counts in your own life.
So maybe a final thought to leave people with. Considering everything we've talked about, the pressures, the strategies.
Maybe ask yourself, what's one small proactive step, habit 1, right, that you could take this week? Something in your circle of influence to manage stress better? Or maybe just to focus more on what's truly important, your habit 2 end in mind.
Or maybe just reflect on which of the 7 habits feels most relevant to your challenges right now.
Yeah, that's a good one too, because consistently applying even one of these principles, whatever your personal emergency might be,
it can really start to shift things, leading to, hopefully, greater effectiveness, more resilience, and maybe even a deeper sense of fulfillment down the road.